then after that, you're going to remove na your PPE inside the patient's room, and then that's the time you call your housekeeping. Okay, now housekeeping. What are you going to do? You are doing na the terminal cleaning. What you will do?
Wear the PPE.
Yes, first also you need to check the isolation precaution of your patient. You must know the status of your patient. What's the precaution? What's the infection? If this is infected or not, so you must know. Then, first, you already wear your PPE. You do hand hygiene, wear your PPE. Then you're going to put the signage outside your patient's door, right? The caution signboard, and you're going to put your trolleys outside the shop. Yeah, you're going to put your trolley outside the patient's door also. After that one, you're going to remove the curtain or collect the waste first. What you are doing?
We need to remove the curtain first.
First, then the waste? Huh? Okay, so first, you are going to remove your garbage. Yeah, garbage first. Garbage, and then you're going to clean the waste bin. After that one, you're going to remove the curtain. So the curtain, in your policy, same with our policy. I will inform you the same with the policy. In the curtains, we have different, based on the area. If it's high risk, like isolation or the patient isolation after the patient leave, we need to remove the curtains, the weight also. Whereas like in wards on not high risk area, it can be removed 3 to 6 months. Okay, so you identify the high risk maybe in A&E. Our A&E, we are removing it 3 months. But inside the isolation room or negative pressure room, after patient leave, we must remove it. Okay?
So in here we are putting the patient in isolation. So we
Yeah.
go back home.
Yes, actually, yes, must be. If you're going to suspect it.
Yes, police affect the case also.
Yes. Maybe you need to discuss it with Dr. Farhan. Dr. Taher, huh? Because in the policy really it states. But if we have any shortage of curtains, I know we have some problems also with
Do
these
we
curtains.
really need to put a curtain inside the room? Isolation room is already closed. The door will be closed. The doctor needs to examine. We can examine the patient.
Yeah, so you don't have any curtains inside the
There is no.
isolation
There is.
room.
I'm saying, do we really need to put the curtain still?
Yeah,
Because
you need to-
every time it will be you one patient, you two patient. Well, this is a really expensive thing now because it's 3 to 6 months, which we can keep it for other things, and we don't need to every time. Maybe if 4 or 5 patients we transfer a day, so it means 4 or times 5 on curtains. So mainly we are using curtain for the privacy. The door is closed already. What is the use for the privacy now? Is there still we need? Do we still need?
It's up to you. So it's kind of, if they will ask you, you will answer as per policy. What is written in your policy?
Throwing every
Yeah.
time. Yeah, every time to throw.
Yeah, but in reality, let's see the applicability and also the availability.
Because now in front of the isolation room will be visual triage room, right? The one since last week we are having discussion and they decided to make it isolation. That room has curtains, right? Previous treatment room. So I told them to remove, no need, because every time the patient will go in, he will touch. Any person will go, the person will also touch. So it means with one way, for example, one day they receive 30 patients to be in that room because they are just suspected. So they should not touch that curtain. So I told them to remove. You remember I told you? Yes. We to remove. But I don't think we need it, those curtains. If there is a need or only we can close the door and doctor can examine. Because it's not wise really to put curtain in these two areas. If the patients are sharing, khalas, we must. For example, this room, there is one patient here and one patient here, we must put curtain. Even in isolation room, there is some probability that you have two patients, the same diagnosis, and we can, two meters apart, we can put like that. But with us, we don't have this scenario. So why we will waste? This is in my point. We can ask even Dr. Tahir, Tawadi, okay, please, before you go, just ask and write it in the answer of inform me, and then write it in the communication group, and please inform everyone, those who are working this girls also, that what is the reply, because it's very crucial. We have limited amount only.
Yes, sister.
Yeah, and then every time they will be removing, removing.
And mostly also you're using this one. Yeah, but also in your clinics, like in here, the other clinics,
Maybe only this room here.
Only we are green.
Okay.
Because this is for us, that's why we did not change. There's no need medicated for us. This room is for us only, for the consultations and lectures. No patient comes here. But all the clinical areas we have to go.
But during the survey, sister, if they will saw some like this in your area, they will ask how frequently you are changing or sending this to them. So it's based on your policy also. Like this is reusable or can be sent to them. So just read or ask about your policy regarding the non-disposable curtains. Okay? So yeah.
Right. The second question.
Keep for the suspected infected patient after the patient leave, but based on your policy, because we are removing it if the patient is infected, any type of precaution like contact rapid, we are really changing it after the patient leave. So here you will discuss it with Dr. Tahir, okay? And then cough etiquette. Also, if you saw your patient is coughing or sneezing, please do some health education. Not only the infection control leaders, okay? You ask them, brother, and tafi ko ha, lasem shilman din, so we cover your nose and your mouth, or cough at your sleeves, not on your hands. Okay, and you inform them also that they need to do hand hygiene, or you can provide them now the surgical mask because we are in the COVID-19 crisis. So any patient with cough or respiratory symptoms, please ask them to do hand hygiene and offer them mask, surgical mask, okay, to contain or to stop the transmission of any viruses. Okay.
Yeah, at the time of even visual triaging, when the patient arrives only, we should offer the patient do hand hygiene first, and then if he is released, so we after hand hygiene he will wear the mask.
Yeah. Okay. So do you send any instruments for sterilization?
Yes.
You have also the closed box. Where are you putting your?
There is no utility room here.
You have utility?
No, we don't have any.
Okay, so where are you putting your used instruments?
We clean the thing same time, and we are putting, we are covering, just we are putting there in the ground. Then we are
There's no any in box.
like this one,
So yeah, because it must be in a closed box. Yes, it must not be treats. Wipe after use. Automatically you're going to put it in the box.
There is a
You're
spray.
going to spray with a magic solution. You have the solution.
Spray. We have
Spray.
Spray, but there is no
Box.
Yeah, but with ENTs, I have seen the stainless steel container.
that is open.
There is not stainless steel container. It's open.
It's open.
Yeah. So
Open container.
Yeah, the tray.
The tray. So it is a tray
it's a tray, but it must be closed.
on the top.
Yung katulad sa dental, di ba?
Same with the dental, but dental, they have a specific tray and it's closable, and they are soaking the instrument to the B40, right? So it's already there. So just put and then cover, and then someone will get it. But for you, for the nurses, yeah, so you must ask also Dr. Tara about it, okay?
But just the last point. And about also
Yeah.
these curtains.
Yeah,
also.
but-
What is the Pusana policy for these curtains?
For us, this type of curtain must be sent to laundry.
Because policy is
Weekly for us.
Weekly. Yeah, weekly. Yeah, weekly for this and for the used instrument. So no rinsing, no washing, no wiping. Put it in a closed container, spray it with enzymatic solution, then close.
Because Kusibahi will ask, we cannot tell that we are doing this one.
Yeah, but because, first, before you answer, you must have this. Because maybe, okay, can I show me? Because they are really good in...
Yeah, they will not listen.
Yeah, checking. Cause you will open, okay, show me your dirty utility. And then, oh, you answer me like this, but where? Yeah, that's why. But, inshallah, if they are not going to check it, really. So, just say this one. This one there must be in a house container sprayed with enzymatic solution. So, that's the standard for the sterilization. Okay, so what else? You're sleepy na. Oh my God, sorry. And then, what else? Okay, let's go with your transmission-based precaution. Or your transmission-based. You know the posters, right? Okay. Yellow for contact, green droplet, blue airborne. Okay. So what PPE you are going? So each transmission-based have specific PPEs you are going to use. Contact. What PPE you are going to use?
Gloves and gown.
Gloves and gown. Okay. Droplet.
Gloves, mask, gown.
You need for droplet one PPE only.
Mask.
Surgical mask. This is only for specific droplet, not combination, because we are combining some transmission, right? So if only droplet, it's okay to use surgical mask. For airborne, N95 or your EAPR. Okay? So sometimes if you see two posters attached to the door of your patient, so make sure to follow the PPEs both. Okay? Like droplet and contact, so you need to use your gown, your mask, and your gloves. Okay? But if you're going to do some aerosols generating procedure, like you're going to suction, nebulization, and then sometimes maybe you will insert PP tube. Yes, so you need to wear the goggles or the eye shield. Okay? So, example of your contact precaution. Disease. What type? What are the diseases that can be placed in contact precaution? Your
MRSA.
multi-drug resistant.
MRSA.
Yes. MRSA. All the multi-drug resistant, they are contact precaution. How about in your droplet?
COVID.
TB is not droplet. So the droplet example, your H1N1, influenza, pertussis, so that's droplet. And then airborne. Example.
Meningitis.
Tuberculosis, chickenpox, measles. Yeah, so that are the specific examples of your nCoV and MERS-CoV transmission is only contact and droplet.
But
Yes.
now
Now because this is very new emerging disease, for the MERS-CoV, if you are going to do some aerosol generating procedure, as what I have said, you need to increase your precaution. That's why you need to wear N95 mask. Okay? Yani for MERS-CoV, if your patient is ambulatory and he's not that critically ill, you can apply the contact and the droplet only. But if patient positive MERS-CoV and he is critically ill, intubated with with oxygen like that, so this patient you must put him in contact and airborne precaution. Yes. So that's how you're going to put the transmission-based precaution to your patient, MERS-CoV and COVID.
I have a question. Do we need to flip the mask or if we use it to protect ourselves? Like
No. Yeah, I saw most of you, someone is using, if I'm going to wear the white one outside, I am protecting the patient because I am sick. And then if I'm going to wear the blue outside, it's like that, sa? Yeah. So no, there is only one way in using the same. Yeah, it's the same. So the proper way is the one we call or is outside. Yeah, the blue one. And then, yes, that's the only proper way of using it. Okay. Any question else? So ready with the COVID. So first, also you need to know the case definition of your COVID. Okay, I will not discuss it anymore. You have your posters and your first code. Please inform your doctors also because they are also asking for the case definition of MERS-CoV, the criteria and the visual triaging and the scoring. So you must have an idea for it. Okay, based on your practice, what you're doing. Like for example, scoring of 4 or more, so it's suspected for MERS-CoV already, right? And if it's more than 6 or more, you're suspecting it as
COVID.
COVID. So based on the epidemiological link and the